So in terms of designing interventions for specific populations, I mean, my focus is mostly on mental health because that's my background, and that's where a lot of the expertise is in terms of Nadaur. These are some things to consider, you know, in terms of program development. So, you know, the first one is the referral pathways. So, you know, you can design interventions, you can design programs, but how do you get your clients? How do you get your referrals? You know, how do you work with the people that need it? So what we're seeing now is the concept of social prescribing is a major referral pathway for forest therapy interventions and for nature-based interventions. And if you don't know what social prescribing is, it's basically it's working with non-medical interventions for specific groups. So it's looking at the likes of maybe arts and health, and nature and health to work with community groups. So the referrals, a lot of the referrals are coming from doctors, from nurse practitioners, or also from social prescribers. I know the UK are really advanced in relation to this. I think Australia is quite advanced as well. You know, also we need to think about assessment. So any intervention we design, obviously we need to have some form of assessment that we know that the people coming along on the interventions are, you know, are suitable for the groups, they're suitable for the intervention. And we'll look a little bit more at assessment shortly. Also, you know, when we're designing any intervention, you know, what do? We have to look at the intervention components. So what exactly does it consist of? And in terms of, you know, research, this is a huge gap. You know, sometimes people say, oh, they're doing 2-hour sessions, but they don't communicate exactly what goes on during those 2 hours. So we have no idea when we're measuring impact, you know, what has been measured, or what mechanism, you know, are we looking at. So it's important to be clear in terms of the intervention components. The delivery, you know, obviously we're trying to standardize delivery methods. So when we're training forest therapy practitioners, you know, we have developed, you know, a specific 6-week program, a specific 12-week program that they can adapt depending on the group, depending on the situation, but there has to be some kind of standardization so we can ensure what we call, you know, intervention fidelity, that it's rolled out basically as people are trained. And then evaluation. So how do we evaluate the impact? What outcome measures do we use in terms of interventions?